I'm Gary Robbins, Executive Director of the Kansas Optometric Association. To my left is Dr. Ken Eakland from Pacific University, and to my right is AOA Health and Information Technology Committee Chair, Dr. Phil Gross. Today we're going to take a few minutes to update you on what the AOA is doing to make a difference with the electronic health records that are coming. The first question I've got for our panel is, what is the AOA doing to help its members prepare for the adoption of electronic health records? Phil, would you like to give us some background on that?
Sure. The AOA has created the AOA EHR Preparedness Program. It contains both website as well as on-site educational components. The new AOA EHR website is specifically designed with relevant information to optometrists on EHR-related topics, and we're hoping that that's going to be a solid source and an ongoing changing source for optometrists to go to find out EHR information. The second part is the on-site program, and that's the Enhancing Patient Care with EHR programs. That's going to be available to affiliates. Currently we have about 20 states that we're already enrolled and going to be going to. We've termed that the EHR roadshow, and that's going to be the specific educational component to help teach optometrists what they need to know about EHRs and how to proceed, how to get started.
Thank you. In terms of, do we have any of the specific purpose and where we're going with electronic roadshow? How is it going to help the average AOA member?
Well, the first thing is that we wanted the roadshow to be something very specific and have a specific purpose. We really wanted to educate our AOA members in a non-biased fashion on relevant information related to electronic health records, and that would be related to the selection, to the implementation, to meaningful use, the available government funding and the incentive programs that are available, so it had a very specific mission.
What should the AOA members be doing now to get ready for what's coming next year?
Well, the number one thing is to go to the AOA's Health IT website. We have a new URL available for that. It's not only educational items and documents, but also presentations on there as well. You need to start educating both yourself as well as their staff need to be educated as well. The regulations are changing so rapidly as we speak daily that the way we've thought best is to use the website to handle those constantly changing information. The second thing to do would be to start participating in PQRI now. It's very important that people start doing that way ahead as early as they possibly can. The third thing I'd say is they really need to start e-prescribing now. It's very, very important to do that and get participating in that now. And the last thing would be to really attend the roadshow that would be coming to your state. That's going to be the hands-on component.
Phil, I had one other question. Doctors do not have to already have a system. I mean, they can go ahead and need to start using the e-prescribing and the PQRI immediately.
Correct.
They don't need to wait until they purchase a new system.
That is correct. You can start doing that now.
Okay, thank you. Ken, can you just give us some insights in terms of what average practitioner can expect to learn through the roadshow and how it will benefit their practice?
We're real excited about this program. This program is going to be very focused, as Phil said. It's not going to be a bias. It's not going to be. We're really looking at trying to explain to them there's myths and the realities of the questions that are going on. As Phil explained, the rules are changing basically daily. We really want to look at what the current incentive program is, what does it mean. We want to talk about very specifically the dates, the deadlines that they have to be able to participate. We really want to look at what's required by individual doctors to participate in the incentive program as part of this. We really want to look at how and try to give the doctors, every practice is different. How can they evaluate, how do they look at their practice to determine what will be important to them in implementation, and how do they determine, if EHRs are correct for them, but once they do, how do they develop a strategic plan to implement the EMRs within their program, the EHR systems? How do they become meaningful users? How do they ensure that these questions are answered before they get started so that, again, they are able to participate? It'll be very specific, very detailed, structured, and organized so that the practitioner can evaluate it and use it and take it home to their practice and do it correctly.
That's excellent. That's excellent. What What should our AOA members be doing right now to get ready for this transition?
Well, there's several things. There's what Phil said about what we should do is checking the website. But one of the other things that I really want to talk about is what should they not be doing right now? And this is the thing. There's so much hype. There is so much push that's going out there. The incentive money is there. There's a lot of people that are, there's misunderstandings. But what I really want them to do is not to jump out there and go buy a system and just without understanding what the rules are, understanding what the regulations, what the needs are, understanding. Just don't go out and buy a system that and expecting it right out of the box that you throw it into your system, into your office, and it's going to do exactly what you think it's going to do. How do you develop realistic expectations? What not to do is not to go out and just buy any system or the system that your other members in your organization or your friends have, expecting it again to work in your office. Every practice office is different. Everybody practices slightly different. And they really need to understand it. And on the other side is I don't want them just to go out and buy it because it's the cheapest or it's the easiest they think. We really want them to be educated to make a fundamental decision of which is the right way to go, what do they need, and purchase and integrate exactly what they need in their office to be successful.
One question I guess I would have is that there are some people feeling like they're pressured into doing this immediately. They do have a window here, and we do have time to make an informed decision, as you say, right? I mean,
the window is not, yes, in answer to your question, yes, there is a window, if you will. The time is taking, though, is to do it right. The strategic decisions, the planning, the implementation, making sure everything does take time. So really, we have to have them right now looking at the website, doing their homework, investigating the structure, start their planning of how they're going to do, look at their budgeting. They need to do that now. Do they have time to buy the system and get it in? There's a window. We do have time. But again, the hype and the push, what we really, this is your office. This is their office. This is their livelihood. They are going to make the investment into an EHR system in any practice is a lot of work. It requires a significant amount of investment. It's both of time and money. And we really, really want to make sure that they do it the right way the first time to be successful.
and it's going to be significantly cheaper, as you said,
in the
as
long
well.
run.
So ultimately, what is the bottom line? What do you two see as the bottom line? Phil, what's your perspective?
Well, if you decide, first of all, that EHRs are right for your practice, the time to really start to do that is now. The time to start moving and planning towards that is now. If you really want to participate in the era of high-tech incentive programs, the time to start with that is obviously now. If you decide, though, that EHRs are really not right for your practice, you really need to just also, if you're not going to do it, you need to understand what that means, what the issues are, and what potential penalties down the road will be. Ultimately, if you want to be part of the global healthcare system, EHRs are going to be part of that. So you're going to need an EHR if you want to be a player.
If I have a practice, and I have a number of practices in my state, but why would I want to come to this program? Because I already have a system. I mean, how would you two answer that question?
I would still say that if you have a system already, the funding and incentives are still available to you, and you would really want to get on the aligning your software now in your office now to make sure that you're a meaningful user of a certified software and to get yourself lined up to get the incentive on.
Okay. Ken, anything you want to add to that?
No, absolutely. The roadshow, this program really is not just for the novice that doesn't have it. It's also, I think, the people that have it, again, understanding the rules and regulations, understanding so that they do not miss out on if the incentive program is there, making sure that they understand the rules and regs.
Well, let me ask you one quick question. On meaningful use, what is your advice to practices when they're talking to vendors? Do you have some specific suggestion?
I would have them come to the roadshow, and we will show them the questions.
Okay.
And that's a question that would take me a very long time. There's a lot of rules and regs.
Thank you.